So, should you go get a genetic test for psychiatric disorders? Is genetic testing helpful in the care for psychiatric disorders? Today, I'm going to share information from the perspective of lab testing, and we'll go over what are the situations where lab testing is very helpful for the care of psychiatric disorders. Hello, welcome. My name is Xiao Yu. I'm a board-certified clinical laboratory geneticist. Here on my channel, I share all things fascinating, interesting, and useful under the broad topic of genetics. If you find it interesting, please click subscribe. So for psychiatric disorders, from the perspective of lab testing, there are two ways that genetic testing can be helpful. First, genetic testing can help establish diagnosis. Two, genetic testing can help provide pharmacogenomic information that can inform drug therapies. So number one, how can genetic testing help make the diagnosis? This applies to the situation where a causal mutation has been established for the disease. And because the diagnosis relies on the detection of the mutation rather than the onset of symptoms, the disease can be detected early and intervention can be started early before illnesses occurs in the patient. An example is phenylketonuria, or PKU. PKU is a rare genetic disorder when, if untreated, it can lead to severe intellectual disability and behavioral difficulties, including temper tantrum and tendencies of self-harm. And the genetic cause of PKU is known. It's caused by mutation in the gene that helps code phenylalanine hydroxylase, PAH. PAH helps make the enzyme that breaks down phenylalanine, which is present at a high level in high protein food such as egg and milk and beans. The mutation in PAH decreases its enzymatic activity. As a consequence, phenylalanine can build up to dangerously high levels in these individuals that lead to all sorts of health problems, including psychiatric manifestations. Fortunately, thanks to newborn screening, virtually all PKU can be detected and a genetic diagnosis can be made within the first few days of life. Newborns can then be treated with dietary intervention that limits phenylalanine intake, which prevent the consequences of this disorder. So this is an example where the causal mutation is known and treatment is available, where genetic diagnosis, when done early, can really help prevent the disease. There are also conditions where psychiatric manifestation is associated with a disorder that can be genetically diagnosed, but there's not yet treatment. In these situations, genetic testing can still be helpful in provide information that help guide how to best support patients and families. Patients and families usually find it empowering to have a genetic diagnosis, even if there's not yet treatment. This is especially true if the patient is symptomatic, and the reason that they go to the doctor is because they're looking for an answer. What are your thoughts? If your quest leads to the answer that says what you have is a genetic condition and there's no treatment, would you find your diagnostic journey to be worthwhile? So those are the genetic conditions that has psychiatric manifestations and they can be diagnosed. In these situations, psychiatric manifestations are rarely isolated. They're usually among many symptoms of a disease. In contrast to that, isolated psychiatric conditions can be very challenging for genetic diagnosis. Let's say schizophrenia. We know that it tends to run in families. However, you cannot simply run a genetic test to diagnose a person with schizophrenia. And the term schizophrenia remains a clinical diagnosis that relies on the detection of symptoms, rather than a genetic diagnosis that relies on the detection of causal mutations. And that's because many of these conditions, including other adult psychiatric conditions and drug abuse disorders, they tend to be associated with many genes and environmental factors, which cumulatively would determine one's risk to develop this condition. Even though a genetic diagnosis is very challenging for these conditions, that is not to say genetic testing cannot be helpful. And this brings us to the second point. If an individual has a psychiatric disorder or a mental health condition and needs to take medication, genetic testing can still be helpful by providing pharmacogenomic information. So pharmacogenomic tests are those tests that help inform how our gene determines our response to drugs. And in fact, our genetic buildup has a strong impact on how our body responds to medication. This applies to many medications, including those that are frequently used to treat psychiatric disorders and mental health conditions. One example is carbamazepine. This is a prescription medication used to treat some kinds of seizures and bipolar disorder. Carbamazepine can cause severe drug reaction in individuals with certain forms of the HLA gene. HLA stands for human leukocyte antigens. These are the genes that encode protein distinguishing between self versus non-self. Individuals who carry two specific forms of HLA, namely HLA B1502 and A3101. These individuals can develop something called Stevens-Johnson syndrome upon exposure to carbamazepine, where they can have quick onset of fever and rapid development of rash and blisters all over their skin, in their eyes, in their mouth, and nose. This is so severe that carbamazepine should be avoided altogether in these individuals. So that's HLA. Beside HLA, we also have many forms of drug metabolizing genes that impact how our body responds to medications, and therefore the safety and efficacy is going to differ from person to person for the same drug. The most up-to-date information is published on the website of Clinical Cancer Genetic Implementation Consortium, or CPIC. So these are the ways that lab genetic testing can help in care for patients with psychiatric disorders and mental health conditions. Are you considering getting genetic tests? If so, please connect with your doctor, have a referral for genetic counseling. Genetic counseling is recommended not only after you get the results, but also before initiation of genetic testing. So that's it for today. If you find it interesting and useful, please like and subscribe. Remember, the world is beautiful because we are different. And I love you to every single base pair.